I'm D.W. Bradshaw, and this is my presentation on the rabies virus. It dates back all the way to 300 BC when Aristotle talked about it. In the 1940s and 50s, the U.S. tried to control it with domesticated pet vaccines. And wildlife rabies occurs in many animals that we see, such as skunks, raccoons, foxes, and our beloved dogs. Almost all human cases are caused by animal bites, and it generally occurs in the ages of 15 and younger. So that young population probably just doesn't understand that the animal is infected, and they are the ones most likely to get bitten. Thanks to Nature Review's Disease Primers 2017 article on rabies, I know that it is in the lyssavirus, and it falls into the Raboviridae family. It is a heliocapsid, an enveloped virus that is negative-stranded RNA. It's bullet-shaped, and so it will fall into the rod-like viruses. It encodes 5 different proteins, and it will attack the central nervous system, so that encompasses the brain and the spinal cord. Following the bite, the rabies virus will spread through the nerve cells and then into the brain and the spinal cord. The viral RNA uncoats into the cytoplasm of the infected cells. Viral RNA is then translated into individual viral proteins. Once in the brain, the virus multiplies rapidly and starts to cause swelling. Replication occurs with positive stranded RNA templates for production of negative stranded RNA. Generally, the incubation period lasts anywhere from 3 to 12 weeks. It's been as soon as 10 days in some individuals. They like to link that to possibly how close the bite is to the central nervous system. And once symptoms occur, the outlook isn't very positive. The cause of rabies is, like I said, it's in the lyssavirus. It is the rabies virus. Transmission occurs from a bite, generally, of infected saliva that penetrates into the muscle tissue. It can be transmitted person to person, but generally it is from another animal to a human. Those animals can be dogs, which in the U.S., luckily, we have vaccinations that have helped with those. Underdeveloped countries, dogs are a likely source of the rabies virus being passed to humans. Also, you see it in raccoons, skunks, foxes, coyotes, and bats. Generally, like I said, it's caused by a bite that the infected saliva gets into the muscle tissue, but it is possible for it to be spread from contaminated saliva to be dropped into open cavities like eye sockets or a mouth. Thanks to Veterinary Quarterly 2017 article on rabies, I know the infectious path, and that looks like an animal is bitten by an infected animal. They will enter it will enter their body through the infected saliva and into the muscle tissue. It will have an incubation period of roughly 3 to 12 weeks. In that incubation period, it will spread throughout the central nervous system, and it will try to reach the brain and the spinal cord. During that time, they will not show symptoms, and they will not seem like they are sick. When it reaches the brain, the virus will then multiply rapidly. It then passes to the salivary glands, and then you will start seeing the signs and symptoms of the disease. Generally, at that time, the infected animal or individual will die within 7 days. The symptoms will onset similar to the flu. You'll have fever, weakness, discomfort of your body. You'll have headaches. You could have itching and prickling sensation at the site of the bite. It will progress to anxiety, confusion, hallucinations, possible insomnia, and you could even have quite abnormal behavior. They have seen hydrophobia, which is fear of water. Like I said, the symptoms, once you have these symptoms, the outlook is not well for the infected person or animal. Death is almost 100%. The fatality rate, like I said, is near 100%. I think they've had 20 cases of humans living that have had symptoms, so it's not very likely that you're going to live if you have symptoms. So it's very important that you seek treatment as soon as possible if you think you've become in contact with an infected host. That will look like you need to get some wound care. Studies have shown that cleaning the area thoroughly helps significantly. They like you to get your tetanus vaccine if you haven't had it within the last 10 years. And then you will start to receive human rabies immunoglobulin and the rabies vaccine, which will occur the day of, day 3, day 7, and day 14. So there's a series of those shots. And sometimes a fifth dose on day 28.